All right, buckling up for this one, folks, because today's deep dive is into the world of stab wounds.
It'd be interesting.
Yeah, you guys sent in a document all about stabbings, specifically to the neck, chest, and abdomen. And let me tell you, it is fascinating stuff.
Yeah, it really gives you a new appreciation for just how vulnerable the human body is.
For real. But also how resilient it is, too.
Absolutely.
Before we get too deep into this, got to put on our disclaimer hat.
Of course, of
This
course.
is for informational purposes only, not medical advice. So if you ever find yourself in a real-life situation, promise me you'll call 911, right?
Absolutely. Always the first and most important step.
Okay, good. Now, where do we even begin with this? Oh, this is interesting. I always thought stab wounds to the neck, I don't know, seemed kind of low velocity compared to other things, you know?
Right.
But the document said way more of them end up needing surgery than I would have thought.
Yeah, you might think a quick puncture wound is less serious, but the neck is such a critical area.
Right, so much important stuff packed in there. So is that what makes them so dangerous?
Exactly. You've got your major arteries and veins, your airway, your esophagus, not to mention all the nerves running through there that basically control everything important.
Oh my gosh, it's like what, trying to fit a month's worth of clothes into a tiny carry-on?
That's a pretty good analogy.
Right.
And to make matters worse, surgeons have this zoning system for the neck, zone 1, zone 2, zone 3. And zone 1, right at the base where it meets your chest, that's like the danger zone.
Really?
Yeah, mess with zone 1. And you're talking about potential instant death because of the major vessels there.
Jeez, that's scary. So it's not just about hitting the vessels themselves, right?
Yeah.
The document mentioned something called the carotid sheath. It sounded very official.
Right. So that's basically the body's attempt at damage control. It's a tough protective sheath that surrounds the carotid artery, the jugular vein, and the vagus nerve, kind of keeping them bundled up.
Oh, okay, so extra protection for the VIPs.
Yeah.
But even that's not foolproof, is it? Especially in zone 1, where it sounds like surgery is crazy hard.
Exactly. I mean, back in the day, any penetration meant mandatory exploration, surgery. They basically had to go in blind and hope for the best.
You're kidding. They just opened it up to take a look around.
Pretty much. But thankfully, we've come a long way since then.
Thank goodness for modern medicine, right?
Absolutely. Now we have things like CT scans and angiography, which lets us see exactly what's going on in there without having to just make a huge incision and hope for the best.
So let's just go in and see, and more surgical strike team.
Exactly. If there's active bleeding or something blocking the airway, it's still all hands on deck for surgery. But now we can often take a more measured approach, which is great.
I bet. That's got to be reassuring for everyone involved.
Definitely.
Okay. So neck wounds, way more complicated than I initially thought.
Yeah.
But let's move on to another area where a stab wound can be a one-way ticket to the hospital, the chest. Now, this document really emphasized how even what seems like a small poke can turn deadly incredibly fast. And why is that?
Well, the chest is basically Fort Knox for your heart and lungs. They're essential, but also a prime target. And any disruption to their delicate teamwork can be catastrophic.
Okay, so one wrong move and it's all over. And this document, it mentioned these terrifying terms like tension pneumothorax and cardiac tamponade. I swear I'm not making this up. What even are those?
Yeah, they sound like something out of a horror movie, right?
Right.
Okay, so tension pneumothorax. Imagine someone slowly inflating a balloon inside your chest, compressing your lung until it just can't work.
Oh, my God.
That's essentially what's happening, and often in stabbings, it's air from a punctured lung that's causing that pressure.
Okay, yeah, that's terrifying, for sure. And cardiac tamponade, is that as dramatic as it sounds?
If not more so. Picture
Yeah.
this. Your heart's trapped in a cage of its own fluid blood, to be precise.
Oh,
Yeah, and this prevents it from beating effectively. And unlike a regular heart attack, you can't just stent open a blocked artery here. Gotta be a much more immediate fix.
okay, so basically two very different but equally terrifying ways that a chest wound can turn deadly in the blink of an eye. I mean, what's the strategy even like to deal with such different threats?
Speed and precision are key, and that's where all the different surgical approaches come in. The document mentioned things like thoracotomy, sternotomy. Think of it like different entrances into the chest, each with pros and cons depending on the injury.
So it's all about choosing your entrance strategy.
In a way, yeah. If time is of the essence, and trust me, it usually is, the surgeon has to pick the fastest route to buy time.
So, like, if they need to get in there fast, what's the go-to?
So there's the anterolateral thoracotomy that's going in through the ribs on the side. Classic chest-cracking open move.
Oh, okay. I've seen that in movies. It's always super dramatic when they do that.
Well, hopefully in real life it's a bit less dramatic. But yes, that's often the quickest way to access both the heart and the lung. Then you've got the median sternotomy, which is splitting the breastbone down the middle.
Oof. So why would they go for that one instead?
That gives a better view if the injury is higher up in the chest, closer to the heart.
Okay, so it's about picking the right approach for the situation.
Yes, exactly. And when it comes to cardiac tamponade, which I know we touched on earlier, that's a whole other level of urgency.
Right. Like, if the heart is literally being squeezed by fluid, how do they even begin to fix that?
It's all about relieving that pressure fast. They do a pericardiotomy, which is basically a controlled puncture of the sac around the heart to drain the blood. It's like letting air out of a tire that's about to burst, but obviously way more delicate.
Oh, I see. So it's not about fixing the heart itself at that point. It's just getting the pressure off so it can function.
Exactly. But any bleeding from the heart itself obviously needs to be controlled too. Sometimes they apply direct pressure, sutures.
Yeah.
Depends on the situation.
Tells you need to have nerves of steel to be a cardiac surgeon.
You can say that again. High stakes, for sure.
Speaking of high-pressure situations, let's shift gears to the third area this document dug into. The abdomen. It's like, whoa, so many organs packed into one space.
Right. A very delicate neighborhood, to say the least.
Totally. And while the document said abdominal stabbings are less fatal than gunshots, probably because of the whole velocity thing.
Right. Lower velocity means less overall force.
Right. But they're still incredibly serious. It's your intestines, your liver, your spleen. And this document, it said that the upper left abdomen is the most common place to get stabbed. I mean, is there a reason for that?
It's possible it has to do with the angle of attack. Think about it. A right-handed assailant would naturally aim for that area.
That's a disturbing but good point.
Uh-huh.
So let's talk treating these abdominal wounds. The document kept mentioning emergency laparotomy, and honestly, just the name sounds scary.
Right. It's not exactly a term you hear every day, but it's essentially what it sounds like, emergency surgery, where they open up the abdomen to get a clear view of what's going on in there.
Oh, okay. So when they just got to get in there and see what's happening.
Yeah, if the patient's bleeding internally and their blood pressure is dropping, that's a major red flag. Same goes for signs of peritonitis, where the abdominal lining is inflamed.
Oh, right, because then you've got infection to worry about.
Exactly.
Okay, so in those situations, it's straight to the OR, no time to waste. But what if it's not an immediate, oh my God, we're losing them type situation? This document mentioned that sometimes they take a wait-and-see approach. I mean, what if they miss something?
That's where all the advancements in medical imaging come in.
So they're not just blindly waiting and hoping for the best.
Exactly. They'll keep a close eye on the patient, repeat examinations, but they'll also use imaging studies like CT scans to make absolutely sure nothing gets missed. It's like having X-ray vision.
Okay, that makes me feel better. So they have ways of knowing what's going on in there even without having to go in right away.
Exactly. And that's especially helpful with these so-called thoracoabdominal wounds that the document kept bringing up, where the chest and the abdomen are involved.
Right. Geez, talk about a double whammy.
It can get pretty complicated because the diaphragm, the muscle that separates the chest from the abdomen, is constantly moving as we breathe. So that makes it really hard to know the exact path of the injury if it's gone through from one cavity to the other.
So it's like trying to hit a moving target, except, the target is a person's organs.
Exactly. That's why imaging is crucial for these thoracoabdominal wounds, because you don't want to miss anything.
It's amazing how much technology has changed how they treat these injuries.
It really is light years ahead of where we used to be.
Okay, so we've talked about the chest and the abdomen as separate things, but what happens when they collide? The document also mentions something called retroperitoneal hematomas, which, to be honest, I have no idea what that is.
So retroperitoneal hematomas, think of it like a hidden leak, but instead of water, it's blood pooling in a space you can't easily see or get to. That's where the danger is.
Okay, and that space is?
Behind the abdominal cavity. It's where some of the real heavy hitters live, your kidneys, your pancreas, major blood vessels going to your legs.
Oh, wow, okay. So not a place you want to have internal bleeding, obviously.
Not at all. And because it's tucked away, these hematomas can grow for a while before they cause any obvious problems, which the document said can be really tricky to diagnose.
So how do they even know to look for it? Like, what are the signs?
Well, if someone has persistent back pain, flank pain, that's a big one, especially if their initial injury didn't seem that bad. Also, if their blood pressure just won't stabilize, that's another red flag.
So it's a bit of a puzzle putting the pieces together.
In a way, yes. And of course, that's where imaging, our friend the CT scan, comes in handy once again.
Seriously, CT scans are like the MVP of diagnosing internal injuries.
For real, they are. It can often pick up a retroperitoneal hematoma, even if it's still small, and then the question is how aggressively do they need to treat it?
Right, because a small one might not be a huge deal, but if it's big or still bleeding.
Exactly. It's a risk-benefit analysis. If the hematoma is small and the patient is stable, they might monitor it closely, do repeat scans, but if it's large, expanding, or pressing on vital structures, it's time for surgery.
Okay, and what does surgery even look like for something like that?
It usually requires open surgery. They have to go in, evacuate the blood, make sure those vital structures in the retroperitoneal space are safe.
Definitely not a job for a squeamish surgeon.
Nope. You gotta have a strong stomach for this one. Okay, we've covered this sort of hidden danger zone behind the abdomen, but what about the organs within the abdominal cavity itself? The document had a whole section on pancreaticoduodenal trauma, which sounds intense.
Okay, break it down for us. Pancreas, duodenum. What are we talking about here?
Okay, so imagine the pancreas and the duodenum as those always bickering but secretly inseparable neighbors right next to each other in the upper abdomen.
Okay, I can see it.
So damage to one often means trouble for the other.
It's like that old saying, if they cough, you catch a cold.
Exactly. And these are not neighbors you want to mess with. The pancreas helps with digestion and regulates blood sugar, while the duodenum is the first part of the small intestine. So that's where most of your nutrient absorption happens.
Right, so super important for staying alive and functioning. So if someone has a stab wound in that area, how do they even begin to figure out what's going on in there?
You guessed it. CT scan time. With contrast dye, they can actually visualize the pancreas and duodenum, look for bleeds, tears, anything out of place.
It's like a high-stakes game of Where's Waldo?
Pretty much. And just like finding Waldo, the sooner they spot the problem, the better.
Right, because then they can treat it faster. But let's say they do find something on the scan. Do they always operate right away?
Not always. Sometimes the body just needs a little help. IV fluids, antibiotics, close monitoring. But if there's major bleeding or damage to the organs themselves, then it's straight to the OR.
And what kind of surgery are we even talking about here for these pancreaticoduodenal injuries?
It's not for the faint of heart, that's for sure. Depending on the damage, they might need to remove part of the pancreas, repair the duodenum, or even reroute the digestive system. It's incredibly delicate work.
I bet. Sounds incredibly complex.
It is. But surgeons are highly trained for this. It's amazing what they can do. Now, moving on to another major player in the abdomen, the liver. One organ you really don't want to mess with.
No kidding, right? It's like every medical show I've ever seen has a scene where someone's bleeding out from a liver injury. Is it really that vulnerable?
It's the blood supply, really. The liver receives a massive amount of blood. It needs it to do all its jobs, like filtering toxins, producing bile for digestion. But that also means any injury can bleed a lot.
So it's like a double-edged sword, essential for life, but also a potential blood geyser if damaged.
That's one way to put it. And because of its size and location, it's in a prime spot to get hit during a stabbing.
Right, it's just sitting there, unfortunately. Okay, so someone comes in with a stab wound, they think it might be their liver. What happens?
First things first, stop the bleeding. Got to stabilize their vitals. And then, you guessed it, CT scan time.
CT scan to the rescue, yet again. What are they looking for in this case?
How deep the wound is, if other organs are affected, how badly the liver itself is damaged. They actually grade the injury on a scale, from minor cuts to major lacerations.
So a little nick is different from like a stab wound that goes all the way through.
Big time. For minor injuries, they might just do conservative management, bed rest, monitoring. But for the serious stuff, especially if there's active bleeding, surgery is really the only option.
And liver surgery, I mean, that can't be easy, right? The liver seems like it'd be so delicate.
It can be really challenging, especially if there's a lot of bleeding. They might pack the wound to control bleeding, suture the liver, or even remove a damaged section if it's really bad.
Okay, wow. So it's not just stitching up a simple cut.
Not at all. Okay, shifting gears a bit, let's talk about the spleen.
The spleen. I always forget about the spleen.
Right, tucked up there under the ribs, kind of minding its own business. But it can definitely be injured in these situations, especially with stab wounds to the lower chest or upper abdomen.
So what's the big deal with the spleen? I mean, what does it even do?
It's a major player in your immune system, filters your blood, stores white blood cells, helps fight off infections. So damaging it can have some pretty serious long-term consequences.
Oh, right. So we need our spleens. What's the protocol if they think someone's spleen might be hurt?
They'll start with a physical exam, see if there's any tenderness, swelling. But you guessed it, they'll need a CT scan to confirm and see how bad it is.
Okay, seeing a pattern here. CT scan. CT scan.
It's a lifesaver, and once they see the images, they'll grade the injury just like they do with the liver.
And I'm assuming the treatment follows the same logic too? Minor injuries, maybe they just watch and wait. More serious stuff, it's surgery time.
You got it. But there's been a shift in recent years towards spleen-preserving surgery whenever possible.
Really? I always thought if the spleen was damaged, they just took it out.
That used to be the standard, but we've learned that the spleen is pretty important, so whenever possible, they'll try to repair it rather than remove it, especially in younger patients.
Wow, that's amazing.
Right. Technology and surgical techniques have advanced so much, it's really incredible. Now, we've talked about the solid organs, the liver, spleen, but what about those long, winding tubes in there? The intestines. Those seem like they'd be pretty hard to miss with a stab wound.
Yeah, it does seem like they'd be vulnerable, just coiled up in there.
And what's inside them makes injuries even more risky. Partially digested food, bacteria, you don't want that leaking out into the abdomen.
Okay, that's a visual I could live without.
Sorry. But you get the point. A hole in the intestine can quickly turn into a life-threatening infection, like peritonitis. And because the intestines are so long and have a good blood supply, injuries can bleed a lot too.
Right, of course. So how do they even begin to diagnose and treat something like that?
CT scans, again, are key. It can show free air or fluid in the abdomen, which tells them there's probably a perforation. Then it's usually surgery to clean up any contamination and repair the damage.
And surgery on the intestines. I mean, that can't be a simple fix.
It really depends on where the injury is and how bad it is. Sometimes they can remove a damaged section and reconnect the healthy ends. Other times they have to create a temporary or even permanent ostomy.
Ostomy, what's that?
It's basically rerouting the digestive system. They create an opening in the abdomen and connect part of the intestine to it so waste can bypass a damaged section.
Huh. Well, that sounds complicated, to say the least.
It can be a big adjustment, but it can be life-saving.
Right, the human body is amazing at adapting.
It really is. Okay, moving on to another pair of vital organs. The kidneys. Those seem like they'd be pretty vulnerable in a stabbing, too.
Yeah, especially from behind, it seems like that would be a pretty easy target.
You're right. The kidneys are definitely vulnerable to those kinds of injuries. And because they filter waste from the blood, regulate blood pressure, damage to them can affect the whole body.
Right, like a domino effect.
Yeah.
So what kind of signs would someone have if their kidney was injured?
Well, pain, obviously, usually in their flank or back, sometimes radiating down into the groin, might have blood in their urine, trouble peeing, or even a fever if an infection starts brewing.
So it's kind of a mix of things, but pain and urinary problems seem like the big red flags.
Exactly. And if the bleeding is bad enough, they might even go into shock.
So this is another one of those get to the ER immediately situations.
Absolutely. Early diagnosis and treatment are key to preventing any long-term damage to the kidneys.
Makes sense. So how do they even figure out if someone's kidneys are hurt?
Usually a CT scan, just to confirm, gives them a clear picture of what's going on in there.
And of course, it always comes back to the CT scan. It really is a game changer, isn't it?
Totally. It's revolutionized how we diagnose these kinds of internal injuries. And then based on what they see, they can decide how to treat it. Sometimes it's just close monitoring, pain management, but for more severe injuries, surgery is necessary.
What does kidney surgery even entail? It just sounds intense.
It can be. It depends on how bad the injury is, but sometimes they can do it laparoscopically. Those small incisions, specialized instruments, other times, they have to do open surgery.
So many factors at play.
Definitely. And in some cases, if the damage is too extensive, they might even need to remove the entire kidney.
Wow, so the stakes can be really high. Okay, we've talked about so many organs. Liver, spleen, intestines, kidneys. I think we've covered them all. It's really impressive how much fits in there.
Right, the abdomen is jam-packed.
It really is. Speaking of organs, though, what about the bladder? That seems like it would be pretty easy to hit, too.
Oh, you're totally right. The bladder's definitely not invincible. It's nestled down there in the pelvis. But a stab wound to the lower abdomen can definitely reach it, especially if it's full.
Right, makes sense. So how would you even know if someone injured their bladder? What are the signs?
No. Pain, for one. Usually low in the abdomen, right above the pubic bone. Blood in the urine is another telltale sign, or having trouble peeing.
So kind of similar to kidney injuries in some ways.
Yes, definitely some overlap there. And just like with kidney injuries, early diagnosis and treatment are super important.
Otherwise.
You're risking some serious complications, infection, even long-term problems with bladder function.
Yikes. Okay, so another trip to the ER if you suspect a bladder injury.
For sure. They'll need to get checked out right away.
And how do they even confirm something like that?
Usually a CT scan shows them exactly what's going on with the bladder, if there are any tears, any leaks.
It's amazing how many times the CT scan saves the day.
It really is an incredible tool. It's completely changed how we diagnose and treat these kinds of injuries.
So how do they actually treat a bladder injury once they've confirmed it?
Depends on a few things: how bad the injury is, if other organs are involved, the patient's overall health.
So it's not one size fits all.
Definitely not. For minor injuries, they might be able to treat it conservatively, just with a catheter to drain the bladder and let it heal. But for the more serious cases, surgery is often the only way to go.
And what does bladder surgery even look like?
They call it a cystoscopy, and it's basically just stitching up the tear. Sometimes they'll need to put in a catheter to help drain the bladder while it heals, but it's a pretty straightforward procedure.
Okay, well, as straightforward as surgery can be, I guess.
Right, exactly. But the main takeaway here is early detection and treatment are key. The sooner they can fix it, the better the outcome.
That seems to be a common theme with all of these internal injuries. Early intervention is key. Okay, so we've covered the liver, spleen, intestines, kidneys, bladders. We are on a roll. But there's one more area, a really important one actually, that we haven't talked about yet. The diaphragm.
Ah, yes, the diaphragm. That thin but mighty muscle that we don't always think about, but that's absolutely crucial for, breathing.
And it's right there in the thick of things, isn't it? Seems like it'd be susceptible to getting nicked.
You're right. The diaphragm often gets caught in the crossfire, especially with those thoracoabdominal wounds that we talked about earlier.
Right, where the chest and abdomen both take a hit. So if the diaphragm is injured, that affects breathing, right?
Exactly. A stab wound to the diaphragm can create a hole that allows air from the lungs or even abdominal contents to move into the chest cavity, which can cause all sorts of problems.
Oh, yikes. So how do they even figure out if the diaphragm is damaged? Because you can't exactly see it, can you?
It's tricky. The symptoms aren't always clear-cut: shortness of breath, chest pain, abdominal pain. I mean, those could be caused by a lot of things.
Right, so not very helpful. So then what?
You guessed it. Imaging. A chest x-ray can sometimes show air under the diaphragm, but usually they'll need a CT scan to be sure.
It's like the CT scan is the ultimate detective. So they see there's a hole in the diaphragm.
Yep.
Then what?
Surgery is usually necessary to patch up the hole. They can go in through the chest or the abdomen, depending on which approach is easier.
It's like they have to become expert navigators of the human body.
That's a good way to put it. So even though we don't always think about the diaphragm, injuries to it can be very serious.
Noted. Okay, so we've thoroughly explored the abdomen and everything in it, but there's one more thing I want to touch on before we move on.
Yeah.
The mental and emotional impact of this kind of trauma.
Right, because it's not just about surviving the physical injury, it's everything that comes after that, too.
Absolutely, it can really take a toll. Surviving a stabbing isn't just about the physical healing, it's about processing the trauma, the fear, all the emotional baggage that comes with an experience like that.
Yeah, that makes a lot of sense. I mean, this document, it briefly mentioned the psychological impacts, but it's definitely something we don't talk about enough.
It's like the hidden wounds. They might not be visible, but they're just as real and can be just as debilitating as any physical injury. Totally. So, what kind of challenges might someone face mentally and emotionally after surviving something like this?
Well, everyone's different, of course, but PTSD is really common, unfortunately. Flashbacks, nightmares, that kind of thing. It's like your brain gets stuck in danger mode, even when you're safe.
Right. Like your body is on high alert all the time.
Exactly. And then there's this whole emotional roller coaster: anxiety, depression, anger, even guilt.
Guilt. Why guilt?
Survivors often blame themselves, wondering if they could have done something to prevent the attack. There's also the guilt of surviving when someone else might not have.
Man, that's a lot to carry around. So it's not just about physical scars, it's about these invisible scars too.
Yes, exactly. And they can take a long time to heal. if they ever fully do.
So what can we even do to help people who've been through this?
I think the first step is just acknowledging that this is a real thing, that psychological trauma is just as valid as physical trauma. And then it's about getting them the support they need. Therapy, support groups, medication. It's about finding what works for each individual.
Creating that safe space for them to heal, right?
Absolutely. Feeling heard, understood, validated, that's so important. And we have to remember that recovery isn't linear. It's not this straight line from point A to point B. There will be good days and bad days.
Definitely. Healing takes time, no matter what kind of injury it is.
So true. Okay, switching gears a bit here. Before we wrap up this deep dive entirely, there's one more point from the document. I want to circle back to the difference between stab wounds and other types of penetrating trauma, specifically gunshot wounds.
The age-old debate, stab versus gunshot.
Right, like which one is worse? But really, from a medical perspective, they each have their own unique challenges.
Right, because even though they both, involve something entering the body, they're not the same beast at all.
Exactly. With gunshot wounds, there's usually a lot more energy involved, which means more tissue damage, a higher risk of complications.
So, like, a gunshot wound is more like an explosion inside the body versus a stab wound, which is more of a precise cut.
Yeah, that's a good way to think about it. And then with gunshots, you have to consider things like the bullet trajectory. Did it go straight through or ricochet around inside? Did the bullet fragment at all?
Because those tiny fragments could cause even more damage.
Exactly. And then there's the shock wave from a gunshot. It can damage organs even if they're not directly hit by the bullet.
Wow. So it's not just about what you can see from the outside.
Not at all. Gunshot wounds can be really unpredictable in that way.
So basically, gunshot wounds are like a whole other level of complex.
In many ways, yes. Of course, any penetrating trauma is serious, but gunshot wounds often require more specialized knowledge, more experience to treat effectively, especially if major blood vessels or organs are involved.
Right. I guess it's kind of like comparing apples and oranges, though, isn't it? A stab wound to the heart is always going to be bad news, whether it's from a knife or a bullet.
Exactly. It's about where the injury is and how quickly the person can get medical attention. That's what makes the biggest difference.
So I guess there's really no simple answer to the question of which is worse when it comes to stab wounds versus gunshot wounds.
Nope. Every injury, every person is different. You can't generalize these things.
Right. It's all about looking at the individual case and figuring out the best course of action. So no winners in this debate then, I guess, except maybe the medical professionals who have dedicated their lives to understanding and treating these incredibly complex injuries.
Absolutely. Huge shout out to all the doctors, nurses, first responders who deal with this stuff every day. It's amazing what they can do.
It really is. Okay, so we've covered the different types of stab wounds, the organs that can be affected, how they're treated. I think we're finally starting to wrap our heads around this topic. But there's one more question I have, kind of a weird one, but it just popped into my head while we were talking about all this. If you were to rank human organs based on their toughness, like their ability to take a hit, recover from a stab wound, which organ would be at the top of the list?
That's a tough one. I've never thought about it like that.
Right. It's kind of morbid, but also fascinating in a way. Like, some organs are just naturally more resilient than others, it seems like.
That's true. Some organs have a remarkable ability to heal, even after significant trauma.
So what do you think? What would be your pick for the toughest organ in the human body? Which organ takes the gold medal for toughness?
I'm going to have to go with the liver on this one.
The liver?
Yeah.
Really? Why the liver?
Think about it. The liver is like that friend who can bounce back from anything. It has this incredible regenerative capacity.
Right. It can regenerate itself.
Exactly. You can lose a big chunk of your liver, and it can actually grow back to almost its original size. Try that with any other organ.
That's true. You don't hear about kidney transplants where they just take a piece from a donor and call it a day.
Yeah.
So it's not just that it's, physically strong. It's that it can heal itself so effectively.
Exactly. It's like it has this superpower of regeneration.
That's pretty awesome when you think about it. Okay, so the liver wins for toughness. Any runners up?
I'd say the intestines deserve an honorable mention. I mean, they have to deal with all sorts of stuff on a daily basis. Acids, bacteria, spicy foods. They're like the workhorses of the digestive system.
They never get a break. So they're more about endurance than, withstanding a single blow.
Yeah, I guess you could say that. They're tough in a different way.
Right. It's like comparing a marathon runner to a weightlifter. Both strong, but in different ways.
Perfect analogy.
Okay, so we've officially geeked out on organ toughness. But before we get too sidetracked, is there anything else from this document, anything we missed that you think is important to highlight?
One thing that really stuck with me was how much emphasis they put on the psychological impact of these injuries. We briefly talked about it earlier, but I think it's worth reiterating.
Absolutely. Physical wounds might heal faster, but the emotional and mental scars can linger for a long, long time.
It's like that saying, the body remembers. Trauma leaves its mark.
It's easy to forget about that when you're caught up in the medical details, the different types of injuries, the surgical techniques. But at the end of the day, these are real people going through something incredibly traumatic.
It's so important to remember that. These aren't just cases in a textbook, they're people's lives.
Yeah, and everyone processes trauma differently. What might seem like a minor injury physically could have a huge impact on someone's mental and emotional well-being.
Absolutely. There's no one-size-fits-all when it comes to healing from trauma.
And we can't underestimate the importance of seeking help if you need it.
100%. Talking to a therapist, joining a support group, these things can make a world of difference.
It's a sign of strength to ask for help, not weakness.
Couldn't agree more.
Well, I think that's a good note to end on. This has been a heavy one, folks, but hopefully you learned something new today.
Knowledge is power, as they say.
Exactly. The more we understand about these injuries, the better equipped we are to prevent them, treat them, and support those who've been affected by them.
Couldn't have said it better myself.
All right, on that note, for this deep dive into stab wounds, stay curious, stay safe, and we'll catch you next time.